So, good morning, everyone. As you all are aware, that yesterday was 21st December, and as decided by an assembly of UN, every 21st December is celebrated as a World Meditation Day, and this initiative has been taken uh, to give a choice, or we can say a right of feeling positivity, falling calm, and uh, getting more and more peace. Because in today's era of fast food, internet, and whatnot, we all are always in hurry, always busy, always anxious. So let's celebrate 21st December. See, whenever any day is celebrated means the things are important. In India, usually we didn't have any Parents' Day, Mother Day, Father Day, but now we have also started it, imbibing from the West. Similarly, this is as per the Indian tradition, our scriptures are also mentioning regarding meditations. But to give a more value of that particular important in our life, UN, you think that UN also has given an importance to meditation, and 21st December is celebrated as a World Meditation Day. So today with us, we have Dr. Mathangi. Thank you very much, Dr. Mathangi, for joining for this particular session. Uh, I think those who are involved in meditation, mind, body, and meditation, to be more precise, are aware of Dr. Mathangi. But then also, I would like to share a few of her achievement and would like to introduce her officially. Uh, she is a professor and head Department of Mind, Body, Meditation, and Lifestyle Sciences at Sri Ramachandra Faculty of Behavioral and Social Science, Chennai. She is a coordinator of IQAC, around 25 plus years of experience, having awards and recognition. A long list, out of that few are Young Scientist Award at national level, Young Woman Scientist Award from Government of Tamil Nadu, Visiting Scientist Award, uh, and Rain Visiting Professorship Award from University of Western Australia, Perth, trained by MHRD under the leadership of Academician Program at Harvard University. NAC assessor invited and delivered more than 200 plus oration, H index of 15, more than 78 publications, two copyright, one patent, three book chapter, and whatnot. So we have very, we can say, master from of mind, body, and meditation. So let's listen directly from the horse's mouth regarding uh, prescription to the clinicians regarding meditation. Over to you, madam.
Thank you very much, sir. Thank you for this opportunity. But before we actually start, in India, when we call yoga, we call it with all the eight limbs of yoga, in which one of it is meditation. So the 21st June that we are celebrating as the International Day of Yoga also encompasses the meditation component. But why this specifically that UN has brought in this day also as the World Meditation Day clearly signifies, though we all focus on asana and pranayama and other things, but where it has to lead to, it is the mind. Are we going there? Probably we are not going there. That's why this World Meditation Day has come up in this regard. So I really thank Chinmay sir for this opportunity. And when he said that it is predominantly for doctors, made me all the more feel good that this is the cohort where we need to work a lot on, because this is the cohort where we actually find there are we are these are the people who are going to take care of us, but are they fine? Are they okay? Are we are not looking into that component of it? This is our problem now. So how do we take this forward is what is my take in this session. Before I go into this segment specifically, I just thought I'll just give you a very brief overview of my department. I'm sure people are aware, familiar with our institute, which is Sri Ramachandra, for primarily a medical college. If this university, a private deemed university, has created a department in this name as mind body medicine, clearly showing how important this field is to be in a medical school. Okay, so with that context, I just thought I'll just give you a very, very small overview of my department as such. Okay, so in our department, though the primary aim has been with the mind, body, and soul, we have started as a very small elective for the students as mind body wellness. Slowly, it started on with a master's program in the same name, recently changed as wellness and health coaching. We also offer art and science of happiness. Slowly, we are moving on to our distance learning as well. It is why this time I have used a different logo here, which is DigiLearn, because we are going to be present on an online as a distance education program as well from this Jan. Now, with this skill set, I or our department, along with our students, also offer the patient care and the outreach. I'm just happy to share that we are definitely called by the different departments just to de stress them. Okay, so this clearly says it might be a postgraduate, it might be an exam going batch, or it might be just the simple nurses. So our department just gets called to say that, can you help us relax? So that's where I'm coming to, like, why? What is wrong with us? Why are we going into this? So I just thought that let us look at it this way. Is there really a problem for us? If there is a problem, before I go into a solution, because it's a World Meditation Day, what is this meditation? Is it even an evidence available for this problem that we are having? Then what should we do? This is the session outlay that I had just thought of for the next, probably next max 40 minutes. That's how I planned it for. I am sure we are all aware of all these young, promising doctors whom we have lost just in 2025. This is not a small number, right? A cardiologist dying, or a senior physician dying, or 37 young doctors or three young doctors in duty dying just by heart attack. See, this I have not included the suicide, which because of stress they have gone in for as well. But just by heart attack, what does it tell us? As we are taking care of others, are we actually taking care of us? I think it is always we say, right, in a flight, we all are there. Oxygen mask first for us. I think if we are good, healthy, and all fine with us, I'm sure the outcome for our patients is also going to be amazing. So, should we not take care of us? This is what my first thought came in. Now, this is a really, really, if I'm going to say now, it is old, but this was actually a wake up call which came on Lancet in 2019. Physician burnout, a global crisis. Every specialty in medicine we have seen having a very high level of burnout. Why? I would have put multiple photographs, doctors sleeping in the OT after a big surgery, right? Postgraduates literally scrambling for some space to sleep around to just to close their eyes. Now, somewhere down, something wrong with us. I am sure all these names that we have put on, right from homeostasis to stress, to how stress can have an endocrine component with neuroimmunoendocrinology or psychoneuroimmunology component, to how do you actually stress. We have been teaching all these things to our students whenever we talk about stress. But are we in homeostasis? Let's take it from there. We know that whenever we are stressed, what happens? But we also know whenever we are relaxed, what happens. So we have multiple things to relax, right? I'm not going to say going out is a relaxation. Going out is probably a deviation from going inwards. That's exactly where our meditation takes us into. Okay. Now, whenever we call it as a burnout, we see three important things that are happening. Number one, the reduced personal accomplishment that we see in ourselves. Number two, emotional exhaustion. Number three, depersonalization. I put in this cartoon here multiple things that are there which could definitely happen, right? Lack of motivation, or feeling tired or drained out, difficulty in concentrating, frequent headache, neck pain, shoulder pain, low back pain, everything psychosomatic, we call it, right? decreased performance in itself. We are irritable to the core. We are not actually our own calm self. Withdrawal from many of the social activities. But what we can definitely note is the physical symptoms. But there are too many other things that are happening as well, right? That was this Lancet, and this is JAMA in 2023. Physicians are more burned out than ever. Here's what can be done about it. This was there in JAMA, where meditation has been one of the highly recommended one for the physician. Chinmay sir, because I'm on the screen and I'm not able to see others, in case there is some issue technically, kindly let me know. I'm sure all of us are there in this profession mainly because we love our work. We love the relationship that we have with our patients. We love the organization with whom we are. There is a value ingrained in all of us. We might definitely want money, but there is always that do no harm, give to others, even if it is at your cost. We have been doing all these things. We are obviously a success is always a teamwork of us. It is just not us. But is or each one of it are definitely weighing heavily on us. Okay. So where is it taking us into? These burnout signs, at least these five, any of you just think, any of these five are there struggling to clearly think. Loss of passion, negative emotion, physical symptoms, and irritability. I think one or the other we are having, right? So now where does it take us into? Emotionally, we definitely get that anxiety, panic attack, or even show our anger on others. Physically, on a long term, if I'm not going to address it, I start to get each of the NCDs right from my unhealthy eating habit to eating junk to getting a metabolic disorder or any of the lifestyle disorder. On a behavioral pattern, I am a changed me now. My performance, my conflicts that I have with others, how I communicate with others, everything has changed, right? So our workplace is doing it. But what we need in our profession is we need in our profession where we are a creative individual, finding a solution to the patients because every time a patient who comes to us is a new patient. We are customizing the care for that patient. I think we need to have that thought process clearly happening in us. Okay. Having set the stage why it is important, now how do I do it? This is a beautiful connectome of health. This connectome of health definitely says that who I am is dependent on the environment. Environment, physically, environment, even as a pollution that we see in, and how my body, the physical body is, and how my mental body is, or the mind is. With all these things, a beautiful concept, this connectome of health came in was with the quantum physics coming in with the consciousness unified field of consciousness which has a link with our spirituality as well. Can we have this beautiful connectome, right? If I'm going to say yoga, it definitely connects the mind and the body, but the meditation connects all of them together, right? So now that's where we bring in a beautiful connect. We are all familiar with the gut brain axis. Now, with meditation, what we are going to see is the heart brain axis, which is an amazing one, not just connecting the neural connections, not just connecting the biochemical pathways, connecting everything that we see in the process. So, this heart brain axis is really very well connected now and studied a lot with the quantum physics coming up into this process. Let me introduce you to the topic of meditation. If I'm going to say each one of us close our eyes, I am sure there will be at least 5 to 10 thoughts that can come in just 5 seconds to us, right? So we are continuously disturbed by the random thinking, right? From that random thinking, can we try to focus on something? Now we are all familiar with the mandala dots, all those art type of a thing, where we try to focus on a particular art We are not focusing on anything else, on that art, concentration completely on that one subject or that one thought. Even if a student is going to keep studying on one particular thing, that is that ekagrata, single pointed focused attention that we have with our thing, right? From here, we go into forcing our mind to focus on a particular thing. It could be an image, it could be a lamp, it could be anything. That is what we call in our yoga as dharana, a focused attention but with lot of awareness. With the dharana, we slowly go into ways that my mind automatically, seamlessly flows into that focused attention. Okay. Now, this defocused meditation, where I am effortlessly able to focus on that one point, is what we call it as dhyana. I think this is the level with which we can all reach up to. From here, there can be a quantum jump where I start to literally feel this physical body is not a limitation of who I am. I see the sublimation of the physical body and just merge with the universe. Right? This is what the great saints and our gurus were able to do, which is called as the samadhi. From here, we can keep going into the higher and higher one till the last one, where we call it as Kaivalya, or the infinite awareness of the consciousness. We don't need to go to all the steps. Can we go till this step of the defocus meditation effortlessly? I'm just sitting and closing my eyes with a couple of breath. I'm able to cut down my number of thoughts and just having that single pointed focus. I think that's all we need now. How do I do that? Right? Or why do I do that? Now, in consciousness psychology, if we see, we just say that there is an immersion in a mental phenomenon, then decentering, then forms and formless absorption, then experiential emptiness of self, and finally the pristine awareness. But what does our Ashtanga Yoga says is, I'm sure you know about Yama, the external discipline, Niyama, our internal discipline, our asana, which is our postures that we normally do, where I'm connecting my movement with my breath. So I'm connecting the mind and the body. Pranayama, which is completely mindful breathing. Pratyahara, where I'm withdrawing my senses from the external and making my senses to go inward. Okay, withdrawal from outside but connecting to inward. Then I'm making all effort to focus on it, which is concentration. Effortlessly, I'm able to focus on it, which is dhyana. And finally, samadhi. Can you see the modern psychology and this almost are similar, right? How are we going here? We are going from our spontaneous thought, trying to focus to the spontaneous thought, to being aware of where and all. We are not going to force, don't shut down. No. Let us first be familiar with where all my thoughts are going, because we don't even know where our thoughts are going. But let's be aware of my thought wanderings that are happening when I close my eyes. I think the first time we meditate, that's a blissful thing. We can see that where and all my thoughts are going. How fast can I jump from one to the other? Think that in itself is a meta awareness for us, like how my thoughts are moving. Slowly reorienting our attention to a couple of it, gently telling, I'll come back to you, kind of a thing, and focusing on that one or two things alone. I think this is possible. Little love on us, but a little focus. The minute we do it, what's happening? I don't think I need to teach about the brain waves. We know about each of the waves. But what is happening is that the minute I start to focus on it, we can see there is an enhanced change in the signals that come from our frontal and our parietal cortex. We call them as the common for mindfulness. Okay. In fact, our prefrontal cortex is actually called in the meditation kind of research as the center for happiness. Now that's the area which is starting to become more active now. Alpha signals coming from there. I keep going on deeper and deeper. Okay, this increases my theta waves now, which is I'm going into a slowly a deeper meditative state. If I'm going to be the first time meditator, I will definitely not come here. I might probably be able to focus on alpha. I've been a seasoned person who is meditating. I can go into this theta way. I keep meditating. When we saw samadhi and beyond that, the higher super consciousness, when we go in, that's where we see this, the gamma waves as well. That is that heightened awareness and that compassion which is there. Okay, probably the monks might be able to go there. Okay. Now, what are we normally having? Highly active beta waves, actively thinking, anxiety, stress. We are processing multiple things, pros, cons, today, tomorrow, yesterday, 1 year later, everything we are processing. So we are having this beta wave. So now what is happening when I meditate? These beta waves are reduced. So I'm becoming a calmer, less anxious, mentally, not too many switches on, only very less region on. That's how it is happening when we start to meditate, right? We have multiple meditation techniques, something to concentrate or focus, something to be openly aware with eyes open. We are doing multiple things. Very, very commonly, we have taken it from the Buddhist mindfulness, right? Could be a mindfulness practice, like the mindfulness based stress reduction, mindful walking, or any of those things in our activities of daily life. Or it could be a guided imagery, which could be a loving kindness meditation, visual imagery, or even a simple progressive muscle relaxation technique, which we do to relax one part of the other consciously, where I'm just connected with my body and the mind. With this, we come to the very famous one, which the Chinese have, the Tai Chi, the Qigong, or even our yoga, which are mindful movement. But all of them cannot be classified into our meditation per se, but they all lead us to meditation. What is meditation is only the first things that I have put here, which are the key types of meditation. There are many more. I'm definitely not going into all of them. At the end of it, where do I want? I want little less of stress. I want changes that happens in the brain which make me adapted to the situation. So it has to be a neuroplastic change. At the end of it, I want myself to be stronger. Psychological flexibility needs to be there. So building my resilience. Meditation does all of them, right? We have number of meta-analysis and very highly reputed journals which have brought in these. I'm just taking this part, the next 10 to 15 minutes, only on those evidences, because that gives us a reassurance that this is not a psychology alone. There is a science behind this, right? Because I'm sure as a physiologist, I also looking for what is the evidence? Can you show it to me? Kind of a thing. Okay. So what studies have shown that is there is an enhanced brain connectivity in people who are long-term meditators. Okay, where in the regions which are needed to be. We all know how amygdala always there is a negative thing whenever amygdala is active. Now, if I'm going to reduce the activity of amygdala, the negative thing is coming down relatively positive awareness. What they have seen is right meditation, whether I am a first time meditator or I have been meditating for 10 plus years. All of us went into a particular stage where we started to get the alpha. So what's the difference? I can do it only when I want. Why should I keep doing it for every day? What they saw was a stimulus given, both of us, there is a change in our way. I'm doing it for the first time or the last 1 month. I dip down and I take a long time to come back to the same alpha. But the person who has been meditating for 10 years, for him also the dip is there, but it's just a small dip, but comes back to the alpha immediately. So, is there a dose response effect? Yes, there is a dose response effect. It's not that you meditate on that moment of time to handle a situation. You need to keep practicing meditation on an everyday basis. Why? What's the evidence for it? They just saw the thickness of the cortex region, especially we just now saw the frontal cortex and the parietal cortex, the thickness went up. The synapses went up. Okay, but along with that, amygdala thinned down. So clearly showing what needs to be active, what needs to be little down in activity were very clearly happening. There was a dose response for meditation. So what they saw was in people who were meditating, the frontal lobe, which is involved in orientation of space and time, there was a decreased activity during the meditation. Okay. Similarly for the parietal lobe as well. Now we have different types of meditation. Did everything show that? Yes. I'm just going to go into one after the other. Let's take one widely studied meditation if we see is the transcendental meditation. So when individuals were asked to practice transcendental meditation twice daily for a period of 3 months, but they were reviewed periodically. After 1 month, what they saw was they were the questionnaire that we use, the Mashlak burnout inventory. They saw a definitive factor like it has reduced. The emotional exhaustion, the depression, the anxiety, and the mental well-being were very, very well handled by this individual in just 1 month. Should I stop? No, please continue. So after 3 months, when they saw there were additional better scoring on the same parameter, but in addition to it, their personal accomplishments were really good. And there was a significant effect size, especially on the depression and anxiety and their well-being as well. Do I end it? No, let's go further. So they started to see where and all it happens, what happens. So what they saw was when it was going on, this adaptability that happens whenever individuals are meditating, they just saw how the depression significantly decreased, anxiety reducing as well, right? This paper was an amazing, and I'm giving you everything which are open access so that like I'm sure we all don't go by just one paper. We need multiple evidences to corroborate what we are trying to say. Even then, we'll not be happy because I need to practice it on myself to see that yes, it works before we confirm on it, right? So, this is one. Next, we go into one more kind of meditation, which is really very, very nice, which I really love, which is the loving kindness meditation. I think we are all harsh on ourselves. I think we need to be a little more loving on ourselves at time, right? That is self-love is a very important thing for all of us. We are always a beautiful critic, that too being in an education with medical education and other thing. I think we are always critical about ourselves, a little bit of care on ourselves. I wish to read this from the author. Okay, this was an editorial that had come. As clinicians, the more we focus on practice and talk about wellness, the more likely we are to engage in healthy activities. In other words, wellness begets wellness. However, busy clinicians trying to meet the needs of their clients and balance work and home life can lose sight of their own health needs and prioritize themselves last. Fortunately, an emphasis on clinician self care and wellness is a growing movement and absolutely essential to help the healers stay well. That's why I said, Dr. Chinmay sir, this is a beautiful initiative. I think we need to take care of ourselves. In the clinician wellness column, experts offer practical advice for optimizing health and provide helpful suggestions for incorporating more wellness in day-to-day living. I'm just happy to say that the Neurocritical Care Society of India has a newsletter which keeps coming every fortnight. I'm sure, if we are all on one side, the critical care experts, they are having a much more of a stressful environment minute to minute with the beep and other things. They've been asking me to write a column on how do they de-stress themselves. It was more on mindfulness with which we are going. We've been doing it for the last 2 years. Very well received. I'm just hoping that they're also practicing. That's the feedback that I've got. That means slowly we are realizing self care is very, very important. What happens in the self care, if we see, it's just not the amygdala. When the amygdala activity is controlled, what happens? There is an increase in goal directed behavior, not only going into and telling the problem and negativity. It is more goal oriented. I have to cross this. It's not it's a problem. How do I overcome it? That is a goal which we have a directed activity. When we see the brain EEG images, EEG recordings, we find there is an increased activation of the prefrontal cortex, increased connectivity between the prefrontal cortex, the insula, and the nucleus accumbens. I'm sure when I tell all these regions, all of us know these are the regions which are very important for our empathy, the self compassion, and positive outcome. Now, how do I hack my brain to make these activities very important? That's it. We are only teaching with our CBME how what is empathy. But how will I get empathy unless and until these regions are activated? Activate these regions. There is no switch to activate. No, that's a false statement. The switch is meditation. The minute you meditate, your prefrontal cortex, the insula nucleus accumbens become activated. Their interconnection comes up. From the default mode network, I am changing it. The minute we change it, what it does for me, kind of it, oh my God, it does so many things to me. That empathy comes in, right? Unless and until the default mode network is switched off, we are not going to change. The regulation of the neural circuitry of emotion, the compassion meditation, everything that we do, we activate this insula when we meditate. So, what is happening? We are having this temporoparietal junction, the posterior superior temporal sulcus actually also becoming active, and there's a greater detection of the small emotional sounds that happens. Okay, I start to meditate on it more so that my response to any of the uh, stimulus that I'm going to see, it is going to be very, very different. I'm not going to be the cold, oh, I've seen versus situation kind of a thing. No, I can understand what you're undergoing. So all these things, what it happens is that our mental expertise to cultivate this positive emotion keeps increasing. So these are the ones which are linked with our empathy. And how do I respond to an emotional cue? Okay. So what I told now has been coming in multiple articles. I took this one because the default mode network from the medial prefrontal and posterior cingulate cortex, need to get relatively deactivated. And that happens if we meditate. And what am I going to make more activated? What are the things that I'm going to couple? If we keep meditating, regions which we are connecting are the posterior cingulate gyrus with the dorsal anterior cingulate and the dorsal prefrontal cortices. Okay. These regions are the one which are directing our senses inwards. That is self-monitoring. I think we all have a tongue in a cheek situation most of the time. Now, that self monitoring actually helps us to recalibrate how I respond. What are my cognitive changes that happens, right? So, our mind wandering actually, instead of going outside, goes inwards, cuts what need to be cut, and that reduces our reaction to negative things. So what has happened in this part is there is an increase in the gray matter volume, especially in the angular and the posterior parahippocampal gyri. Whenever we do this loving kindness meditation or compassion meditation, the minute we see more gray matter, I'm sure as medical people, you know what is happening in those regions. And this region, affective regulation automatically for my empathy, my anxiety reduces and my mood is little more compassionate both outside to within to myself. Okay. So where am I leading on to? Being mindful or being mindful? I think we need to be mindful. I'm sure all our minds are like this only. Can we be mindful? Just a couple of key things that we are doing now. Being present is very, very important. Whenever we are present at a particular thing alone, we can just see that focused attention that we have. We are non judgmental at that moment. We are able to see the smallest cue which we would have missed in our busy day. The minute we don't miss those things, could be a non-verbal cue or could be a thing on the monitor or could be a subtle change that has happened. Everything matters to us when we are doing a patient care, right? So can we do those things? That's what comes in. We have different meditation. We have seen one by one. One of the common one that we see now is the heartfulness meditation, right? I'm sure many of you would have been a part of the heartfulness meditation yesterday night at 8 p.m. with Daiji, which was, though it was only for meditation good of the globe, but it has also set a Guinness record with the maximum number of people joining on a YouTube for a mindfulness meditation. This was a heartfulness meditation. So what are we happening? We've just put, this is our energy plane that quantum physics actually say. The physical plane, the vitality, the emotional, the mental, and going into the different levels of the spiritual. I'm sure you all know physical was our asana and other thing. Vitality was our pranayama, which we did, right? Each one, see how we are. This is how we are. Okay, what they saw in the study that they did was each of these people changed with just a 40 minutes in the heartfulness meditation from a scale here to see the scale here, right? So in every energy plane, they showed a significant difference. Um, uh, the participants and the others in the study were all only clinician, and the study is from the US along with the Heartfulness Foundation here at Hyderabad Kanha. So like this, we have the different one, the mindfulness practice. I'm just going to wind up this evidence that we have. We have mindfulness practice as advanced training for clinician, digital mindfulness training for burnout reduction in physician, maintaining mental health mindfulness techniques for clinician. If I'm going to put all these things, please see the journal that I put it. Every specialty, they are trying to make their colleagues in that specialty to go into meditation so that like they are able to have lesser and lesser clinician burnout. What is it that they saw in all these studies where significant reduction in stress and burnout, increase in mindfulness and meaningfulness, automatically lesser error, better patient outcome and patient care, less judgmental attitude, and less reactivity facets of mindfulness. There was a decrease in emotional exhaustion. What more do we want? I think that's where we all started. The MBSR or mindfulness based stress reduction gives an 8-week program, each one very thoughtfully curated with simple movement to focusing to being having gratitude to even communicating mindfully, living in the present to loving yourself, as well as finally you do your own protocol which you want, because everything doesn't suit us. I would really recommend everybody to take this 8 week of MBSR. Okay, it is actually given free if we are a team of 10 or 12 people as well. Otherwise, it's a charged one. This 8 week, I tell you, it is a life changing one. The way we look at things, it will itself be very different. Okay. Just a quick one. I just thought the clinician's wellness, the self care for staying healthy, and loving kindness meditation for wounded moments. It is very, very important, right? So now, may I just welcome you all to just close your eyes for a few moments, please? Please close your eyes and just follow my instructions alone. Wherever you are, please, you can, if you want, you can switch off your camera and we'll just have a very calmness within for the next 5 to 7 minutes. Please sit comfortably. If it's possible, kindly remove your footwear. Place your feet firmly on the ground. Sit relaxed Let it be a quiet environment where you're not going to be disturbed. The only sound that you're going to hear is my voice, which is going to guide you. Kindly allow yourself to guide you through this process. Softly but gently close your eyes. Observe your breathing, your natural breathing, air moving in, chest expanding, and air moving out. Consciously slow down your breath. We have all the time now to give to ourselves. Let your breath be a little long, but slow and even. In and out from your abdomen. Gently bring your awareness to your heart. Imagine that this is your peaceful sanctuary. Using your mind's active imagination, create the sanctuary, temple, a garden, a oasis, a sacred grove, or your safe haven, or a refuge, exactly as you wish. Visualize it as minute as possible. In this peaceful sanctuary of your heart, there is so much space, so much freedom, and so much happiness. It's yours and yours alone, created just by you. Feel the expansion of the infinite possibility. Feel the calmness. Feel the complete relaxation. You're unbounded and you're free. All is beautiful both inside and outside of you. All is well. Take a deep breath into your heart. Let the breath encircle the rib cage. And with your exhalation, let go of the fear, worry, and the doubt. Let all these leave as you exhale. Take another deep breath. Let it fill your chest completely. And as you exhale, let go of the pain, both physically and emotionally. Sigh it out. Imagine filling the chest cavity with the nurturing oxygen and luminous light as you breathe into it. Your heart is lighter, softer, and is more open, floating like a cloud in the vast blue sky. Now I invite you to call in the light of the loving kindness, just like a friend who comes when you call. So too does the loving kindness. Call loving kindness in the language and form of your choice. Feel the light of loving kindness bathing you, washing over you, and answering you, filling your heart's chambers, your chest, and the glow spreading throughout your body. Now let us scan through the events of the day. Recall any moments that were hard or hurt. The hurt may feel like just a little overwhelming or fatigue from the patients that you're caring for, or the difficult news that you had to share with the patient's family. Pause. Hold each of these painful moments from your day with loving kindness. Just surround whatever comes up with the tenderness, the gentleness, the mercy, and the generosity. Immerse this moment in all this pure healing light in the temple of your heart. Allow it to soften. This hurt does not belong to you. It is not you. Compassion is here. Embracing it completely and unconditionally and understanding it. So too, embrace the moment. Continue scanning through your day, pausing at the wounded moments. Apply the loving kindness to each of them in turn, as a word, as an image, or as a feeling. Notice how you feel after the practice. With your eyes closed, feel the changes. Feel your natural breathing has come down. Unconsciously, your number of thoughts are reducing. Take it easy. Whatever happens during your meditation practice is, in essence, healthy, creative, and healing. Remember, there is no right way or wrong way of how to do it, or how it is supposed to go or be. Each one, it is different. But just practice letting go of judging or analyzing your experiences. Play with it, experiment it, try it anytime, anywhere. Stay calm, take a couple of breaths, feel the joy, feel the glow in your heart, and gently open your eyes. I hope you just felt there was a lot of calmness. It was there in you. So each of the things that we do, whether I do a focused attention to get the alpha wave or long term I practice to get the theta wave, the outcome is going to be enhanced focus and sustained attention. I do these mindfulness practice. Automatically, you see, again, the alpha and the theta coherence that happens in the different regions of the brain, we find that I'm able to be control myself, both my emotion and my attention. With the practice of the compassion meditation that we just now did, there is a heightened level of positivity, a lot of compassion. Compassion starts with first self compassion and then goes beyond. If we keep practicing it, there is that rewiring happening, not from the default mode network to the new network that we are creating for ourselves with this meditation. As we keep practicing any of these mindful meditation concepts, we just feel that there is an improved problem solving in us. A lot of positive attitude, along with that, my negative emotions and worrying significantly reducing. Facilitates sustained attention, and I'm able to observe multiple things around me. There is a decreased tendency to self references because I'm aware of me now. The emotional intelligence goes up like anything. Increased openness and extroversion is definitely there, though senses are indrawn. We cultivate mindfulness, we are observant to small things that are happening around us and also to our attitude. With our emotional intelligence going up, our emotional stability automatically comes in. We are definitely more curious, receptive for even new experiences. That means I'm going to listen to others' suggestion. What more do I need? I have a lot of insight, lot of problem solving. Now, all these things we know they are benefit. People have said, now we know with the neuroimaging studies and the electrical recordings of the EEG from the brain and all the brain heart connections, those neurotransmitters, the peptides, the neuropeptides, and the immune regulating factors. We clearly know these are not farce, these are not imagination. It does happen. The wiring changes. We know that with meditation, all these things happen, right? But along with that, now we know how it is happening with the increase in the serotonin and change in my behavior, with the healing becoming better if I'm going to focus on that region where the operation is taking place, my immunity becoming well, with my natural killer cells also becoming more active. Right? Blood flow increasing with my heart rate coming down. So I'm going to become very efficient machinery with a reduced BMR but increased efficiency. Significant exercise tolerance as well. It is just not to the patients, to us when we practice, right? Slowly leads us to a deeper level of relaxation. As we see, the synaptic connections have been increasing, creating a lot of attention and awareness. Serotonin at the synaptic level increasing, automatically my mood, sleep, general well being goes up, right? Definitely not depression at all. I don't, we as clinicians, when we have an upset, when we are upset, we definitely go for any of our SSRIs. Now, why? Meditate, you have your serotonin release from yourself. That can take care of that particular situation. You might, if me, it is not, then let's start to take the external drugs as well. But I can generate it myself. Let us generate it ourselves, right? No cost, nothing, right? So it all does by multiple things. Even the reuptake has been shown to reduce, right? It's not just the psychological well-being and eudaimonia, but it definitely not only increase release and increase synthesis, but reduce uptake, make the serotonin bioavailability to be longer. No doubt to say we don't get attached or addicted to just the reels and the insta reels or the any of the social media. Even meditation can be addictive. That happiness to just that focus, that blissfulness that comes in, increased level of dopamine will definitely be there. Automatically my irritability comes down, neuroplasticity comes in, synchronization with the different regions which are very important also happens. So every region of the brain has now shown, be it the frontal brain, the parietal, the limbic region, autonomic nervous system, and the long-term effect. I didn't go into HRV because we are always talking about HRV alone, which is one of our marker for the autonomic balance being restored by meditation. But not just that. We have multiple other things which are happening as well. So, can we just handle this epidemic of burnout that we see in our clinician? Simple solution, meditation, a low cost. And we now know there is a evidence as well. So, can we just take that inner kitty to just remain focused, increase our attention, reduce our burnout, improve our sleep, take care of our emotional health and as well as our immune function so that we don't fall sick. We are available for our patients. We are available for our students to learn from us. Oxygen mask first to us. I just definitely wish to say before I end, there are potential risks as well. For some of us, all the type of meditation will not suit. We can probably try. I know a couple of people when I did it, They could not do meditation with their eyes closed. They were getting lost. They were just finding it to be more overwhelming. So it depends which type of meditation suits you. Take care of that. Okay. And then practice. Individualized approach is what is needed. That's why MBSR of John Cabot, he gives it in a way like each one of us can modify what suits us. Because it's definitely not one size fits all, even for meditation. That's why we have at least 14 to 17 types of different meditation techniques in itself. What suits us, let's take that. But let's start it small. Let's start it small. Just 1 minute if I can focus. Perfect. Make it to five. Then slowly make it to 10. Okay. Slowly. It could be like just a breath awareness as I'm standing in the signal, right? A simple thing. 1 minute breath awareness, we know from a respiratory rate of 12 per minute, I can bring it to 6 per minute. That in itself shifts the balance from sympathetic to parasympathetic, right? Instead of 5 minutes per cycle of my breath, I'm making it, sorry, 5 seconds per cycle of my breath, I'm making it 10 seconds per cycle. Shifts the balance in itself, right? Can we have use validated methods like how I have shown you from the articles? Let's try that first on us, not just what we see on Insta. Let's put the small practices. I always say use it as a mini. Just try very small thing. Be very mindful initially. Focus on your breath. Then just close your eyes and focus on your breath. Just have your cup of tea till it gets over. Focus on just that one leaf or that one image or one spot in your room. Just focus. Slowly do that with your eyes closed. We can make our pratyahara, driving our senses inwards. Integrate it into your daily practice. It is not a dedicated one because you're working professionals extending beyond a time. If we can integrate it, that's amazing. But if we can have, like we have the break yoga from the Ministry of Ayush, which is really catching up in the IT company. Can we have a couple of times when the bell rings, we all silent? The 2 minutes of silence that we give on Martyrs Day, can we give to ourselves before we become a martyr? Can we just do it? Let's learn to slow down. Get lost intentionally. Observe how we judge both ourselves and around us. So, the mind is definitely something that can be transformed, and meditation is one of the means to transform it. Let's try that because we do have people like Dalai Lama, Swami Vivekananda. Everybody really be a change maker just by diverting all their senses inwards and meditating. That's it. What stops us? No cost, nothing. Just focus. Just wish to end with a thank you to Chinmay sir. And this is that 1 year program on wellness coaching that we are starting with this Jan 6. You can just see like if this is going to go on, how important it is for people are looking for their wellness. If wellness is so very important, then why are we not going to go through this cost-free method of simple focus your attention on inside you, that beautiful oasis, that beautiful temple in your heart that you have created. That should be your go-to place immediately to recharge you, not just the recharge that we have for our mobile phone. Recharge us to that spot you have created for yourself. Each one of us create in one way. Could be the lotus where our Ishta is sitting. Could be the place where I sit and calm myself. Could be a place where I can be myself, my own critic, my mirror, and meditate on that. But don't fail to focus. Meditate. Probably it is dharana for all of us. Number one, pratyahara. Divert all your senses inward. Dharana, with difficulty try to focus. It will be difficult. I'm not going to say it is easy. It will be difficult. That's why we have to make an effort to focus. The minute we make an effort to focus effortlessly, like how we drive a car, we can drive our mind into the place where we want to. It automatically, the minute you go and sit, we all know that sometimes we take our bike to our office. Even if it's a Sunday, the bike will directly go only to the office direction, like that. The minute I sit on my mat for meditation, my mind automatically knows switch off, switch off, switch off. Now only one side focus. That is effortless, automatically going there to dhyana. And then you have that happiness of what we are looking out for. Thank you so much.
Excellent, madam, as usual.
Thank you, sir.
Uh, and I think it has generated a lot about your course and everything. I think they all can approach you
I'll be
by
happy
email.
to. Sure. Now, this
Request
was
you to,
mainly
madam,
not
please
for
share your
an
email ID in chat
advertisement.
box. So those who want
This
to
was
join,
not for an advertisement, but this was
yeah,
just to say like how it is actually making real sense. We
no,
have
no,
got
but it is
really nice. So many clinicians have also joined us too.
study and research in meditation, and we are also promising result. So I will be getting back to you for more detail regarding how can organize
Yeah.
workshop online, offline, and definitely this will be of great help. Again, thank you very much for sparing your time and letting us know the different viewpoints. You want to share anything? Any participant want to share any query, anything? They are most welcome.
Dr. Kailash, I will share my slides to Dr. Chinmay sir so that he can share with all of you.
Yeah, sure. Thank you. Thank you very much, madam. So, madam has shared the email ID and mobile number. Those who want to get more detail can contact her. Madam, again, thank you very, very much. And as there is no more question, we will be winding up the session. Thank you.
Thank you very much, sir. Thank you.
Now, thank you. Nilesh bhai, we can close the session.
Okay, sir.